from whatever one has heard and seen of this as a doctor, someone who works in ICUs, is this a credible explanation that we're hearing from the owner of the hospital, who's now saying that he wasn't actually trying to risk the life of his patients, but that he was trying to actually, in a sense, wean them off oxygen, even though some of them were turning blue?
Yeah, so Vasu, if we go by the initial videos which went viral and what is being said,
yeah,
I mean, this cannot be called a mock drill. A mock drill is when you are trying to find a backup. If there is a lack of oxygen, then you shift to other modalities of oxygen being supplied to the hospital. Like if you have a liquid medical oxygen, then if you are running out of that, then you cylinders, etc. And if you are titrating the doses of oxygen and the target oxygen levels, which is like if the target levels were between 90 to 96, and then you are trying to reduce it further and seeing how the patient is doing, you don't wait till the patient gets blue. You have to titrate it so that the patient is comfortable even at the lower level of oxygen.
Right.
So there are certain subset of patients where you can bring it down to 88% also.
So if a patient, in simple terms, if patients start turning blue, is that a risk to their lives, especially if they're in already a critical
absolutely
state? It is.
Absolutely. Blue means that there is absolutely inadequate delivery of oxygen to the tissue. The saturations probably would be somewhere like 75% or so. One is that. Second is that if the patient is in shock, what medical term of shock is that the blood pressures are low, etc. So even at higher oxygen levels, the patient can turn blue, because these are sicker patients and the oxygen delivery to the tissues is not being adequate.
Okay, so you have also been in a ICU in a hospital where there has been oxygen shortages at Holy Family. I'm sure you were also faced with this crisis-like situation. Was there ever a scenario where you would, attempt something like this? Because to an ordinary person, this sounds crazy, that you are trying to reduce the oxygen, they're turning blue, to give a shock to the relatives, that you take your patients out.
I mean, if this is true, this is totally unacceptable. I mean, oxygen supply was low in hospitals in Delhi, and including our hospital. We were titrating the doses to keep the targets where the oxygen delivery is adequate to run organ function, not when the patient turns blue.
Okay.
So there could be a subset of patients where 88% may be adequate, oxygen levels could be adequate for a certain period of time. But not everybody. Pregnant patients require high, right? Patients in shock require higher oxygen levels.
Okay.